I want to thank both of you in the sense also that you were kind enough and to allow us to amend the bill by putting in the Improved Well-Being for Veterans Act. And what we're trying to do is just give the VA some more tools in the toolbox in dealing with veteran suicide. Myself, Senator Warner, have worked hard on this, and what we're trying to do is just create a new framework for better coordination with existing veteran suicide prevention programs across the country, help the VA create a common tool to measure the effectiveness of programs that are improving mental health outlook and resiliency. The way that we've measured this in the past regarding veteran suicide is capacity. You know, do we have programs? You know, let's increase more programs. But we haven't really measured the effectiveness of those programs. So despite the fact that we've had significant increase in capacity, the rate of veteran suicide remains the same. Since I've been in the Senate, 2010, we still have about 20 a day. So we have to do something a little bit different. We have to continue doing what we're doing. The problem is, with our suicides, only 6 of the 20 have anything to do with the VA. So we've got to capture the others. So over the past decade, the mental health and suicide prevention budget at the VA increased by 83%. During the same 10-year period, the suicide prevention outreach budget alone increased by 233%. Despite the sharp increase in funding, the rate of veteran suicide has remained roughly unchanged at 20 per day. Only about, as I said earlier, 6 of the 20 are receiving health care services at the VA. We prioritized suicide prevention in recent years, yet it is clear there are more steps that we must do to save lives. Just this month in Arkansas alone, a veteran of the National Guard, along with 2 current National Guard members and a member of the Army Reserve, took their own lives. Our approach simply isn't working. We all share the goal of saving the lives of veterans, and it's time to empower the VA to work through community partners to expand outreach to those 14 veterans who are desperately in need. There are more than 50,000 organizations that provide suicide prevention services for veterans, yet they are hard to find, hard to access, apply for, and use. The VA and these organizations share the same common goal, but lack the framework and authority to coordinate their efforts. It's time that we have a better coordination of existing programs, a common tool to measure the effectiveness of our programs across the board, and better information sharing, data collection, and continual feedback in order to identify what services are having the most impact. So again, all of us, are working together to make a dent in this crisis. And I do appreciate your all's hard work in making it such that we could come to an agreement so that we could change things up a little bit, and in a real effort to identify those 14 that aren't being identified, not using VA services, so that they will have an opportunity, and hopefully in the not too distant future, instead of talking about 20 a day, 20 to 22 a day, that we'll come back and say, we've had a significant decrease in that number. Thank you, Mr. Chairman.